I have a sick loved one, and there's a solution for it, and the best possible treatment was, to be a living donor, and that's basically all I thought about. I never thought about anything in between. And I was eager and anxious. I was the one that I felt got the ball rolling. I got people, I said I was the donor, and I wanted I wanted to do it now. I wanted answers. I wanted to know, why can't we do this? He's on dialysis. He doesn't need to be on it, and I'm going to be his donor.
What should I be thinking about when considering living donation?
Well, when deciding whether to donate, it's important that you understand the possible medical, psychological, and financial risks. You can stop pursuing living donation at any point if you decide that this is not the right decision for you.
Hi, my name is Natasha. I'm our Transplant Center's living donor advocate. I'm here to protect you as a patient and your rights as a patient. We will do your medical evaluation, evaluate you front to back, head to toe, inside and out to make sure you're a good candidate for donation. If at any time during that process we see that you cannot be a donor, we will stop the process at that time.
The first thing, it was my dad, my twin brother, and I, and the first thing they did was a blood draw on us. So we each went in, they took like 4 tubes of blood, and then we had to wait for the results of the blood test to find out if our blood matched with my dad's blood.
Then donors get a complete workup. They get the EKG, the chest x-ray, the blood work. They may need additional testing based on their age. So if they're over 50 and they haven't had a colonoscopy, they may need a colonoscopy. A woman might need a mammogram, a pap smear. The final tests for the donors also is a CAT scan that looks at their kidneys to make sure that they have normal kidneys and it's safe to remove one.
I remember going through various, physical, just to make sure I was able to go through surgery, and then going through more specific tests to make sure that I had 2 kidneys, make sure they were functioning properly, make sure did a CAT scan, X-ray, ultrasound of the kidneys.
Then you start to see the nephrologists and the psychologists and the social workers, and they were all very supportive, and they all reassured me too that if there was at any point I felt like I wanted to change my mind, I could do that, and I didn't have to have any reason, and they made me feel comfortable that I didn't need to continue any further if I felt I wasn't prepared for it.
It's very important, as I said before, that you do not feel pressured into donating. You can stop the transplant at any time, even on the day of the surgery. You also have to think about how your relationship with the kidney recipient might change. You might have body image changes afterwards. Also, there's no guarantee how long the kidney may last. I know you want it to last for as long as possible. And on average, a living donor kidney lasts 15 years. But how would you feel if the kidney only worked for a few years or didn't work at all? This might make you upset or guilty.
The primary risk that I understood was basically just from surgery. Not that it was a kidney, not that they were taking my kidney out or that I was going to be without the kidney, but it was just the surgery itself was the primary risk, and that was pretty minimal.
What are the medical risks of the surgery?
In the short term, there are risks of complications. Normally, the doctors remove the kidney through a very small opening, a few inches in length. However, if complications arise, the opening may be made larger and recovery time would be longer. You might have bloating and nausea after surgery. Other possible risks include problems from being put to sleep, infection, fever, bleeding, blood clots, scars, pain, and fatigue. The risk of problems from surgery is less than 5%, and the risk of death is less than 1%. However, some deaths have occurred. Every effort is made by our surgical team to reduce all possible risks to you.
Those are some serious risks to consider.
Yes, that's why I'm really happy you're here. We're talking about them, and I want you to read a lot more about them.
Can she live okay with just 1 kidney?
Yes. Over the 3 to 6 months after they donate a kidney, their remaining kidney slightly enlarges and works faster, hyperfiltrates, to get back up into the very lower part of the normal range. And that's what we look at, is that they have enough kidney function to begin with that when you take one away, the remaining kidney can grow a little bit and get back to the normal range.
I'm not a doctor, but a lot of conditions that will come in that might potentially affect your kidneys, they generally don't target just one. They generally affect both of your kidneys and your kidneys as an overall bodily system. So the fact that I was giving up one didn't make me think that I was going to be at a higher risk for needing a transplant in the future myself.
Kidney donors women can have children, men can father children. For women, we recommend that they not get pregnant for 6 to 12 months after donating a kidney. The reason being that first 6 months, their remaining kidney is kind of enlarging and working faster and getting back up to its normal kidney function. So we don't want to add a strain in on it.
My sister wants to be a living donor. Who pays for that?
Your insurance, health plan, and Medicare will cover your living donor workup and surgery. And there are some outside costs that are not covered by them, and that would be child care, travel expenses, time off of work. But there is a program called the National Living Donor Assistance Center, and if your donor qualifies, they may be able to get financial assistance for travel, lodging, and meal coverage.
Donation in rare circumstances may also affect your ability to obtain or afford health, disability, or life insurance. You might also have issues obtaining employment if you work in areas like military service, law enforcement, aviation, or fire departments.
They had all the information to tell the doctors which of my kidneys was the best one to take, how they were going to map out the surgery to actually connect arteries and things like that. In other words, in months before the actual surgery, they were putting together a game plan for us that was going to make sure that this thing went well.
As I was going through this process of having all the tests and learning all this information, each test, the results kept coming back positive. In other words, there were good results from each test in that every step of the way our match got better. And we were pretty excited about that. We knew we were compatible all along, and it's nice to have the doctors tell us that.
After that last test and everything was fine, okay, when do you want to schedule it?